Good morning, everybody. Welcome to the second day of World Health Summit 2020 in Berlin. This panel is about national responses to COVID-19. I have the honor to co-chair this panel with my distinguished friend and colleague, Professor Adnan Haider from George Washington School of Public Health, who will be joining me to run the session with you. We have a team of distinguished panelists this morning from academy, from the civil society, industry, and from the national levels in order to discuss how the differences in response to COVID-19 has been bringing different results to various contexts. The thing is, since the beginning of the pandemic in March 2020, when it was declared by WHO, different countries from across the world, almost all of them have been affected. But we will see there are different outcomes because of the national responses. Even though there are some guidelines, there are some good practices, and there are some good examples from different parts of the world, still due to some challenges and the governance, the leadership, the contextual differences, the access to information and facilities, we are witnessing the different outcomes, unfortunately, in terms of mortality and the burden of economic and social impacts of COVID-19 on different societies. This panel is aiming to allude into those kind of differences and discuss from the various real experiences by this distinguished panelists to see why these differences exist across the different continents and countries, and then how we can learn from each other in the kind of comparative manner to somehow improve our practices and the way that we are dealing with this pandemic in the course of recent history. My name is Amir Hussein Takian. I'm a physician and I'm a professor of global health and public policy and the chair of the department and vice dean at the School of Public Health, Tehran University of Medical Sciences in Iran. And I have the privilege and honor to be the co-chair of this meeting. We have 5 speakers this morning. Professor Adnan will not presenting the case of the United States. He will be kindly moderating the discussion and bringing more intellectual discussion into our panel. And then I will ask him to intervene in a minute. But we start from the experience of Hong Kong. And as the first speaker, I have the honor to introduce a very good mentor and good friend of mine, Dr. Margaret Chen. Dr. Margaret Chen is known to everybody. And now he is the president of BAO Forum for Asia. She comes from the People's Republic of China, was the Director General of the World Health Organization for 10 years from 2007 until 2017. And now she's the Director General Emeritus of the World Health Organization. I remember myself that Dr. Chen was leading the leader of health globally in a very difficult time. When she started, it was the economic downturn, and then the Ebola, Zika, and SARS epidemics and pandemics happened, and she was very enthusiastically changing the organization towards more meaningful results and more reforms. And then she appointed in March 2018, after the WHO, as a standing committee member of the Chinese People Political Consultative Conference in China. And now she's serving as the president of Global Health Forum under the BAO Forum for Asia. Dr. Chen obtained her BA and MD and DSc from the Western University in Canada and MSc in Public Health from the National University of Singapore. And she has completed some management courses at the Harvard Business School in Boston. Dr. Chen, floor is yours. I would appreciate if you can address us about the experience of Hong Kong, and we will be enjoying your presentation. The floor is yours. Please unmute yourself.
Thank you very much, Professor and Dr. Amir, a good friend and old friend. Let me also want to appreciate the invitation from the World Health Summit for sharing our experiences. This is a very important platform. Now, let me share with you the COVID-19 response in Hong Kong. As you all know, Hong Kong is an integral part of China, and it is an international city with numerous transport links with mainland China as well as with the rest of the world. And Hong Kong is also a very densely populated and elderly city. For that, I qualify for one. Now, Hong Kong remains one of the places in the world with the lowest fatality and infection rate from COVID-19. Hong Kong has experienced actually 3 waves of infection since early 2020. The first wave was from mainland travelers and causing a small local spread in terms of cases. And that was at the beginning of 2020. The second wave was a surge of imported cases from the rest of the world, primarily from UK, from US, and from our returning residents. And this lasts till March to May. And the third wave, perhaps the most severe outbreak, lasts from July to September. The infection was introduced from individuals who were not required to undergo mandatory testing, and subsequently there was widespread community infections. So Hong Kong had 3 waves. Now, in each and every one of these challenges, Hong Kong managed to stop the local spread with a combination of border control measures, social distancing, involving, in some cases, closure of school, work from home. And in the most severe wave, that is the third wave, we had to introduce bans in certain hours, in certain places, to basically limit gatherings and enforce social distancing. So another important measures that we have introduced is, of course, personal infection prevention steps. And people in Hong Kong are very used to wearing masks and also hand washing. They see those as simple common sense measures to protect oneself from infection. Last but not the least, Hong Kong has a very robust health system for surveillance, testing, contact tracing, isolation, and of course, treating of infected cases. Now, in a nutshell, Hong Kong's strategy, we call it suppression and lift. Suppression and lift is actually based on the epidemiology of the situation in Hong Kong. And it seems that this strategy is working very well. Hong Kong does not have to go through complete lockdown. This approach tries to balance. On the one hand, you need to deal with the epidemic. You need to prevent it. On the other hand, you want to maintain economic and societal activities. That is important for an international city like Hong Kong. So other important factors contributing to the success of Hong Kong's control is, of course, the city has a very robust and also capacity in terms of the health system. And last but not the least, the support of the general public have been an integral part to the combination of factors that make Hong Kong's response to COVID-19 successful. So perhaps let me stop here and we'll listen to other colleagues, and then before we go into the other rounds. Okay?
Thank you very much, Margaret.
Amir.
Thank you very much, Margaret, for very insightful experiences that you shared from Hong Kong, which will be great for all of us to learn from. And I will get back to, in the second round, get back to you, and I will ask you more background about the Chinese experience as well, if you don't mind, because I'm sure you can somehow let us know some lessons from the Chinese experience as well. That would be great. For those colleagues who joined us recently, welcome to this panel discussion number 10 on national responses to COVID-19. I'm very glad to see all of you here this morning. Just for some housekeeping issues, if we have decided to run, all the speakers will be addressing in the first run. And then if you had any question, please type down at the end of the button. All of us, we will see the questions, and then we will do that in a good manner, and I will ask the colleagues to raise the question. Just one point for my technical team. Professor Chen is trying to join, and he says he has sent a message that he's online, but unfortunately we don't have him among the speakers. Can I ask the colleagues to ensure that Professor Chen is in the right place to present? And then perhaps I need to get back to him as a third presenter. So our second distinguished speaker will be Dr. Jo Nurse. Jo is from the United Kingdom, and she's a strategic advisor to the Interaction Council, a group of former heads of governments. And in this position, she's advancing collaborative action to secure a healthy planet for all. She's a very experienced advisor, and she has worked with the government of the United Kingdom, with the World Health Organization, and with many different organizations in the past. From 2010, she has been working initially with the World Health Organization. She qualified as a medical doctor, and she got some training in primary healthcare, and then she got her PhD in public health policy and is a visiting professor in planetary health as well. One thing that I'm really keen for Jo to share with us this morning is this Interaction Council, and then the framework, the policy framework that Jo, along with her colleagues, has provided for COVID-19 responses and going back to normal and healthy recovery. When I was reading this interesting document, I learned a lot, and this has a great capacity for the rest of the world to learn from. Jo, floor is yours to go and to take us through to the Interaction Council COVID-19 framework for COVID-19. We are very keen to learn from your experiences. Floor is yours, Jo.
Good morning and welcome everyone, and thank you so much for the World Health Summit for this opportunity to speak to you all. I've actually prepared a pre-recorded PowerPoint presentation to share with you this morning, partly because my puppy seemed to have chewed through some of the cables, and on Friday when I tested the presentation, it kept breaking down. So I'll hand over to IT, who will show a video of my presentation, but I hope to be able to join you fully for the Q&A session. Thank you. Good morning. Today, I'm presenting on a COVID-19 policy framework to enable global, country and community level responses. This is part of an initiative by the Interaction Council, a group of over 40 former heads of government, which mainly focus on peace and security issues. Over the last few years, following the Ebola outbreak, they focused on global health security challenges, including the planetary emergency, and more recently this year, the COVID-19 pandemic. The COVID-19 policy framework is part of a 30-page report that's based upon the illustrated graphic and outlines a flexible approach that can help support country and community level responses, including establishing a common goal and setting up governance and leadership structures like emergency committees, legislation, expert groups and ethical responses, all with a key function of coordinating and communicating an integrated multi-sector plan at community and national levels. These outlined with the 5 main pillars here, of which the first 2 are basic public health measures, followed by the middle pillar, which is the health sector response, and further supported by the last two pillars, which are multi-sector community resilience and ensuring security and stability across populations. These are underpinned by cross-cutting research, recovery plans and recommendations. This framework builds upon existing public health approaches to respond to global security challenges. For example, the World Federation of Public Health Associations Global Charter for the Public's Health, which has in turn informed the development of the Commonwealth Health Systems Framework, of which part of this has been taken forward with a health protection policy toolkit. These are all part of a wider global security response, often profiled by heads of government, including addressing conflict and climate change. The framework highlights good practice case studies from a range of different countries, many from across Asia, Sri Lanka, Jordan and Kenya. These highlight things like having a fast response with high-level political commitment and coordination of multi-sector action, and the utilisation of established public health measures and infrastructure as key pointers to success. I said I'd say a few lessons from the UK as a UK national, and in particular I'd highlight an initial late response to the pandemic outbreak in the UK, but also the establishment of separate private sector delivery systems which have been inadequately integrated with existing public health and primary healthcare infrastructure, have unfortunately led to high levels of deaths in the UK. A relative strength, however, has been the vaccine research and, of course, the NHS response. The framework from the Interaction Council has been endorsed and has the follow-up support from a range of collaborative international partners and has been disseminated by the Council to current heads of government around the world, as well as international policy makers and think tanks. The framework also outlines global responsibilities, emphasising the importance of strengthening UN and multilateral collaborative and coordinated actions underpinned by ethical responses. Towards the end, the framework also outlines key recommendations for the future to build together a healthier planet. And in the final part of the panel, I will outline some of these recommendations. Thank you for listening.
Joe, thank you very much. I'm sure this framework has lots of things to share with the rest of the world. Well done. And we will ask some more clarifying questions towards the end for this very important framework from you. Still, I'm asking my colleagues in the IT to try to locate Professor Chen from Taiwan on the presenter's view so we can have her presentation with us after this. The third speaker is from the industry, from the private sector, and it is very important to have a kind of balance between the private sector and the public sector in terms of responding to COVID-19. This is affecting many things in our life in countries, like for instance, in many low and middle income countries, the countries are struggling to somehow balance the national and the local priorities in a way that they can save their people, provide enough testing facilities, PPEs, and other things. Our third speaker is Dr. Martin Fitchit. He's a medical doctor, and currently he's the head of global public health at Johnson & Johnson. He has a long history of working in different capacities with Johnson & Johnson. His focus is on accelerating development and access to transformational innovation, specifically for low and middle income countries' inhabitants. As I said, he has more than 20 years of experience to advance the critical solutions to prevent disease for those impacted by tuberculosis, HIV/AIDS, mental illness, and other public health challenges. He got the medical degree from the University of Nottingham Medical School in the United Kingdom and became the Fellow of the Royal College of Surgeons of England in 1995. And later he joined the Faculty of Pharmaceutical Medicine in London, United Kingdom. And Martin is going to share with us how actually the private sector and industry, in this case, Johnson & Johnson, is trying to make and contribute to this very important balance. Martin, floor is yours, please.
Amir, thank you very much for that kind introduction. Also, thank you to you and Adnan for chairing this, and also to my esteemed fellow panelists and to the audience around the world. So as you said, my name is Martin Fitchit. I lead global public health for Johnson & Johnson. This is in fact an end-to-end organization where we are an organization that has a research and development arm, as well as access and a field team in Africa. And we are looking to develop novel pharmaceuticals and technologies that will help relieve suffering in underserved communities for certain diseases. The diseases we focus on historically have been HIV, drug-resistant TB, mental health, neglected tropical diseases such as soil-transmitted helminths, and also vaccines, recently Ebola. And of course, I think along with everyone on this panel, this year has been consumed with our focus on COVID. So the topic of the panel was around national responses, but Dr. Nurse, I was delighted by your presentation preceding mine around a coordinated international response, because that's really where I'm going to go, and particularly the role I think we can all play in it and the role we've played in industry. So in terms of when we consider national responses, it's perfectly expected that national sovereign governments will look after their populations as best they can and as a priority. But I think we know for a global pandemic that really nobody is safe until everybody is safe, and no national strategy can succeed unless the global pandemic is eradicated. And I think that's something that we really cannot forget. I think the learnings of the best and indeed the worst national responses should all be applied to a politically and I think financially supported strategy for global coordination. And I think the national response is only part of a response, and the solution for any country is that we have to have an international response that learns from all the best and the worst lessons from national strategies so far. My first point is around collaboration. Unless we focus on global eradication, all geographies, all social economic groups, the pandemic will continue to wreak havoc both medically and economically. That is just a fact. From where I sit as a doctor and a scientist, actually the collaboration has been remarkable. From the first sharing of a genetic code from Chinese scientists at the very beginning of the pandemic, to the fact that we are in October now, already in many phase 3 studies of multiple vaccine candidates, I think we should consider a remarkable achievement. So from a scientific collaboration perspective, the alliances and collaboration that have been forged rapidly across academia, industry, government, and regulators has been incredible. I think that's important to recognize. There is so much talk of vaccine nationalism and the problems and the issues that need to be solved, and they are real. We have to also acknowledge the remarkable advances in scientific collaboration that have got us to where we are today. And this brings me to my second point, and probably the most important point, given that I lead global public health for our company, and that's on equitable access. So if we think of the national responses, these have been fantastic in many cases, but very few of them have actually resulted in a sustainable suppression and eradication of the virus. And in fact, even the most successful countries will ultimately be unsuccessful unless we have coordinated global eradication of the virus. Therefore, I think it's important to state some recent studies and some data that I think should really shine some proof points on this. You may have seen a recent Northeastern study that stated that the mortality rate, this is mortality, not infection rate from COVID, is expected to be 2 times higher if the first 2 billion doses of vaccine are given to rich countries only, 2 times higher mortality. Vaccines will not aid the pandemic quickly unless they are delivered equitably. And it's a really important statistic, and I think many of you will know this, but I think it merits repeating, that right now, Most of the pre-ordered vaccine we know is slated for rich countries. Over 250% of vaccine, 250% of what is needed has already been pre-ordered by rich countries. So that's 2.5 times the amount of vaccines that's needed for the numbers of people in their respective countries for rich countries. That's compared to 14% of vaccine that's being pre-ordered for low and middle income countries. So I think we have a significant issue here that we need to address. And I'm glad to say this is being worked on by many groups together. I think it's important to say that although we will likely to have systems where we will reallocate excess vaccine from rich countries, I don't believe, and many don't believe, that is enough. We need to have an a priori assignment of the right amount of vaccine at the right time, at the same time as rich countries to low and middle income countries, to reduce projected mortality and eradicate the pandemic faster. So just reallocation of access, I think, whilst I think laudable and important, is not going to be enough. The countries that we are talking about also suffer a significant comorbid disease burden: TB, drug-resistant and drug-sensitive TB, AIDS, HIV in Africa, malaria. In many of the poorer island nations, they're ravaged by diabetes endemics with cardiovascular disease and also chronic renal disease. Not only do these diseases in low and middle income countries make co-infection with COVID a much more dangerous event in terms of complications and fatality, many of these existing diseases where we're making significant progress have been put on hold whilst resources are diverted to COVID. It makes for synchronous and aligned equitable distribution of vaccine and therapeutics to low and middle income countries even more urgent. I'm really pleased to say, in response to this, as an industry, via a recent communique from the Gates CEO Roundtable, I believe at a high-level UN event, there was a commitment for equitable access to vaccines and therapeutics. Indeed, Johnson & Johnson has committed 500 million vaccines to be made available to low and middle income countries as early as the middle of next year. I think this is a good start, and I think it is good progress. But I'm really looking forward to discussing both the national responses, but also the relevance of the importance of global coordinated responses, so we can optimize our response to this pandemic. So thank you very much, Amir. That's the end of my introduction.
Thank you very much, Martin. It is always fascinating to see how, out of all these challenges, the private and industry and the public sector can come together to somehow make this as an opportunity to address the needs of the most vulnerable people around the globe. What you said in terms of equitable access to vaccine reminds me the important point that Dr. Tedros said yesterday in his remarks in the opening ceremony, that we need to concentrate on giving vaccine to some people in all countries, rather than what you said, 250% of the vaccines is pre-ordered for all people in some countries. This is the huge paradigm shift in terms of equity of access to the vaccine, that all countries are responsible to work on that. You raised many important points, which I get back to you in the second round of the intervention and the question time. And then with this, I would like, first of all, Professor Chen, I'm very happy you joined us finally. You were supposed to be the second presenter, but I'm thankful to the IT team that put you in now. We are very happy to have you on board. And I would like to introduce you to the audience and then invite you to make your intervention and contribution. Professor Chang Chuan-Chan is the immediate past dean of National Taiwan University. He is a Harvard University scholar and Takemi Fellow International Health, and currently the immediate past dean of NTU College of Public Health, and the director of the Global Health Center at National Taiwan University, and a professor of environmental and occupational sciences. He's an old friend from the M8. I've had the pleasure to meet with him, chat with him over lunch and all the occasions in terms of the public health issues. And this time in the stands, he's in Taiwan, I'm in Tehran, but he has published over 170 scientific papers, and he is the member of the board of directors of associations of school and programs of public health and many other prestigious associations. He's also the senior advisor to the Taipei City Mayor, a member of Taipei 2050 Vision Committee, and a member of Vice Executive Officer for the Council for Sustainable Development in the Taipei City Government. We are so pleased to be with you this morning, Professor Chang, and we are privileged if you can give us the national experiences of Taiwan in response to COVID-19. The floor is yours.
Should I start it, Amy?
Yes, please, go ahead.
Okay, yeah. Thank you for giving me this opportunity to share with you the Taiwan model of COVID-19 control. And if I have time, I will talk about a little bit about its implications globally. You know, in this ongoing global pandemic of COVID-19, Taiwan stands out a leading country in preventing any major outbreaks until now. And I call it a Taiwan model of COVID-19 control, which includes border control, contact tracing digitally, and universal mask wearing and social distancing. And you know, the reason we can start doing this is the hard lessons we learned from 2003 SARS outbreak. So a previous outbreak will give the whole society, professionally, laymen, a very profound lesson. So we are kind of more prepared. Taking this border control as an example, we are one of the first country to start doing border control for travelers from Wuhan, you know, then the China, then the rest of outbreak areas. We started very early because we know that's a very important one. So the lessons we can give to the rest of the world is timing. The right thing you have to do very early as possible. So border control, you know, we started December 31st on board checking the temperatures for all the travelers from Wuhan. Then we have a more severe ban on all of this. So border control is very important. The other one is, you know, the digital tracings and trackings. You know, we have a national insurance systems, and every citizen has a national insurance card. So we, from the beginning, integrate the travel histories, integrate that into our national insurance card. So every clinic and hospitals, they can insert this IC card and to know people are coming from potential affected areas. That's save a lot of energy of tracing and tracking. And we also, you know, apply information technology to perform digital tracing for those who are in quarantine and isolations, and identify people who has been in close proximity in confirmed cases. You know, these new technology we did not have back in 2003. So, you know, you use digitalities to compete with the transmission of virus. We are competing. We never can catch up the speed of virus, but we can approach it. So this, I think, digital tracing is very important. The other one is we start the rationing nationalized surgical mask, because we know we need to have a universal mask wearing policy. And every country are short of this important personal protective equipment. And our governments, you know, announce national requisitions back in January 30th. And on February 6th, we start a very innovative way we call name-based mask rationing systems. You know, everyone was opposing to masks. And, you know, you can see people line up to buy masks. And the behavior of line up in front of drugstores for about 1 hour to get 2 masks per week. I think it's a symbol that the compliance of people with government's control measures is so high. So our society play a very important role. It's self-awareness, and we do more than that government asks for. And you know, after the SARS, wearing masks in public transportation has been very common. Most of the time, over 70%. So during the pandemic, it's almost universal. Then the government mandate, and the mandate mandatory wearing is can push the final one to have universal wearing in buses and public and MRT, etc. So this important. The other one is this social distancing. When we had these outbreaks around the world, and it's at that time we are not surpassed 100,000 cases in the world, and we decided we better delay opening the schools. So instead of closing the school, delay opening is very important because you buy time and avoid of people coming back to schools. And it works. I think in Hong Kong, in Singapore, it all works. You delay this opening the school is very important. So I think I would advocate delay opening, not closing. I think that's very important. When the school are ready, you know, we have all these school ready for hygiene, for wearing mask, for all of this, so we can do that. Also for cultural activity, when we saw a lot of clusters through religious activities, we convinced our cultural religious leaders, not the regulator, communicated with them to modify the mass gathering in cultural activities. I think those are also very important. Then we introduced this 1.5 meters social distancing rules in all the public spaces. And this is also one part of Taiwan models. So with all of this, that we can have a very good outcome until now, you know, very low number of infected cases, days, and never had this hospital be overrun. So we are lucky now. We don't have many super spreaders. And however, one challenge behind us is how to deal with in the future the vaccines, the more testing that Taiwan are very, very difficult to get there. And one thing come up with this Taiwan model is the leadership. So we have a Minister of Health, then we have a Prime Minister, and we have a President. So these three layers of command chains are very smoothly. And the reason for that is, you know, sometimes you have a personal contribution, because Vice Premier was my former student, and he
Dr. Chang, if you can conclude in a few seconds, that would be very much appreciated.
Okay, so one person with public health training with MD degree, serving in government is very important to go around and to make all the policies. So that's come back to our education is important. We have to educate our public graduates to go do the politics. So in conclusion, I think that every country has different way, and I just share with you the Taiwan models. Hopefully this is useful for all the countries. They are still facing the challenge all of us are facing now. Thank you for this opportunity to share with you. Yeah.
Thank you very much, Dr. Chang. I mean, the Southeast Asian countries have done a tremendous job in order to control the disease, and in terms of tracing, built upon their experiences from the past pandemic, specifically in 2003. And this is fascinating to learn from you guys in regards to that. Finally, before we go to the second round, and I ask my co-chair to intervene, let me share with you very briefly some experiences from Iran. We are a little bit behind the schedule. In Iran, we had a kind of situation that, as you see, this is the latest updates. You can see in the Eastern Mediterranean region, Iran has the highest number of coronavirus cases, and unfortunately, the highest number of cumulative deaths, which is uncomparable to the rest of the region. And if you look at this right-hand side, you can see that the number of daily lab-confirmed COVID cases has been increasing, and this is because of increasing the capacity of testing in the country. Please do remember that the first case was discovered on 19th of February, in the city of Qom, south of Tehran. And now this is the situation of the whole country. And we can see that almost more than 4/5 of the country is in the red situation. And that's the situation. If you somehow compare the median age of selected countries, you can see that the age of Iran is really low in terms of this. And then in terms of age and sex, you can see that most of the cases of death are happening above 80 years old people, and most of the active cases are about 60 to 70 years old. So the elderly are the infected, and then most of the cases are among men, and which somehow repeats the pattern of many other countries. These are the most important statistics that I want to show you. On the left-hand side, you can see that these are the people who were admitted in the hospital from of the pandemic up to now. So you can see that in May and June, we had a kind of recovery. And then again, unfortunately, this is going up. And from the second week of October, the number are going up as well. And the PCR test is going up as well. But if you look at this bottom line here, you can see that the PCR capacity has been up to a few days ago, almost stable. And these are the number of confirmed cases of death. We can see again, we have never got back to the low numbers. We have reduced the numbers, but again, we are officially in the third wave of this. And these are at the bottom here, you can see the outpatients, which are in orange, and the inpatient hospitalized patients who are in yellow, in blue, sorry. And then in the death cases in Iran, you can see that we have had the third wave, and now we are at the highest number of the cases of death, unfortunately, which are happening. So this, having in mind, you can see, I just want to remind you about the structure of the health system in Iran, which is unique. And we have the Ministry of Health and Medical Education, which is the main provider and decision maker of the health system. But in addition to that, we have Supreme Council for Health and Food Security, which is responsible for intersectoral collaboration. But I want to bring to conclude some challenges and opportunities. Since February, when the first cases were identified, the Ministry of Health established the National Headquarters for COVID Management with the decree of National Security Council of Iran and the Supreme Leader's approval. So the highest political figure of the country approved and got engaged with the decision-making and providing a system, a kind of multi-sectoral system with the Ministry of Health and Medical Education at the heart of that. And in line with that, in Iran, we have 32 provinces, provincial and university-based team aligned with the national team were established for decentralized decision-making. And we relied upon the civil society and lots of non-governmental organizations, religious groups for emotional support of the patients, families, and healthcare workers. And unfortunately, so far, we have had over 300 people who lost their lives from the healthcare providers because of this. And then the national committee has been given them some kind of national recognition, like their martyrdom, and to their families, support to their families and things. One thing which I would like to highlight here is this COVID-19 happened in Iran at the time of the toughest sanction, unilateral sanction by the United States against the country. So you can imagine that access to tests and different protective equipment and medicines and many things was very, very difficult because of this unfair and the highest ever sanction which happened. But the good point was relying on the sufficiency of the country, the National Committee established knowledge-based corporations and hubs, and the government put resources, for instance, 1 billion extra euro with the decree of the Supreme Leader to produce masks and PPEs and diagnostic lab tests and even vaccines. In Iran, there are some vaccine trials in phase 2 at the moment, and we are working on that very heavily in order to get them. Expansion of the laboratory capacity across the country and providing educational opportunities for the human resources and infrastructure is one of the other things. At the beginning, we had only less than 10 laboratories across the country who could identify and do PCR. At the moment, we have over 250 laboratories across the country, and it has been expanded quite dramatically. But there are some challenges. One of the biggest challenges is emerging normal. People are somehow frustrated because this happens at the time of economic sanctions and the difficulties in terms of economy, and engaging with the public in order to get aligned with these restriction measures is one of the important issues. From the beginning, we could have enjoyed in better capacities the fantastic primary healthcare infrastructure that we have. Some of you, like Margaret, for instance, you have seen this big capacity of primary healthcare that we have across the country, one of the best in the region. We could have used that in better capacity for exactly what you said, Chan, in Hong Kong, in Taiwan, or perhaps Margaret in Hong Kong. The way that we could use these community facilities in order to trace, digital tracing and active identification of the cases, we haven't used that capacity in good ways, despite some good use of our electronic health record system and the use of the different facilities at the primary healthcare. But most of our investment has been on the secondary care so far. The lack of whole of government and whole of society approach, which can be improved, is another thing which I would like to emphasize at the moment. And we hope that it was just last week that our Supreme Leader called upon the National Coronavirus Committee, and they had a meeting with the Supreme Leader, and now the policy is changing in dramatic ways in order to provide some facilities for the primary healthcare and active tracing, and wearing masks and providing PPEs for many other people. And finally, we are working very heavily to strengthening our CDC and the long-awaited reform for community-oriented healthcare, and by mostly the family physician program and facilitate some opportunities for the whole of the system, and specifically at the first level of care, to do that. And hopefully we can get out of this devastating process that at the moment we have. Otherwise, Iran has been experiencing a very difficult time in the course of last few months in the battle against COVID-19. Thank you very much for listening. Experience of Iran. So far, we have had 5 experiences from the 3 nationals, and I mean, I guess 5 nationalities. We had experience of Hong Kong. We had the experience of the NGOs and the Interaction Council by Joe, and how the global leaders came together in order to bring a good framework. We had the experience of the private industry, and we had the experience of Taiwan and Iran as well. So these are just some lessons to see how different outcomes are somehow rooted and related in different policies. We are at the very important moment of history in order to tackle this disease. Before we go to the second round, first of all, I would like to ask all the audience to put their questions at the Q&A. I've received some questions so far, but if you have any questions, do that. And by this, I want to introduce my great colleague and great friend, Professor Adnan Haider. Adnan is the professor of global health at George Washington University. He is a pioneer figure of global health, and he has been in different positions. At the moment, is the senior associate professor of global health at the Milken Institute School of Public Health at George Washington University. Adnan brings over 20 years of experience of working in improving global health, specifically in the context of low and middle income countries across Africa, Asia, Latin America, and the Middle East, and pioneered empirical work around the road traffic injuries, trauma, health system, and NCDs. Currently, he also serves as the founding director of the Center on Commercial Determinants of Health at George Washington University. He has published vastly over 350 scientific papers and lots of global and international reports with international organizations. Previously, Dr. Haider served as Associate Chair of International Health and Director of Health System at Johns Hopkins University Bloomberg School of Public Health. Before he joined George Washington University, Adnan received his MD from Aga Khan University in Karachi, Pakistan, and obtained his MPH and PhD in public health from Johns Hopkins University, USA. Who better than you, Professor Haider, can bring somehow in-depth discussion about what is your reflection upon all these national experiences? Please share us with us your wisdom. Thank you.
Well, thank you very much, Professor Takian, and welcome to all to this session. Thank you, the World Health Summit, for helping us organize this, and to all my wonderful plenary speakers. This has been a great review of the global situation. Because we are running a few minutes late, I'm going to say a few reflections to help in our discussion. And I hope, as I can see already, there are some questions, but I want to make a few points so that it aids in our discourse. And I'll make it according to the presentations that were provided. I think first, I want to go to what Margaret raised, which is the tension between health and opening the economy. In the discussion, let's talk a little bit about this tension and how this tension is, on the one hand, real, but on the other hand, has been politicized. Let's dig further into this dilemma and begin to think, what is the balance between health and economy? Second, I really think that the policy framework that Joe highlighted is incredible. It's an opportunity for us to reflect and to think. And I love this connotation of being serious about this pandemic. I think this reminder to us from the Interaction Council that we've got to be extremely thoughtful and extremely serious. This does not mean that we are not being serious, but what it means is that we have to be incredibly smart and incredibly innovative in the challenges that is posed by this pandemic. I think Martin brings a very important discourse around collaboration and a particular attention to low and middle income countries. I think that is incredibly important for us to bring whole soul in front of us, because not only are what he said are some nationalistic tendencies, but also that a pandemic is exactly that. It affects all of us around the world. It is not a disease for high-income countries. It is not a condition that is affecting only one continent, but it is a truly global health problem. So let's discuss and unpack that a little bit more as well. Professor Chang reminded us that not only are we talking about a medical or health phenomena, but we are actually talking about a phenomena where the entire society needs to take attention, needs to take action. So this is not about just the Prime Minister or the President or the Minister of Health doing things, but it is about each and every single one of us making a contribution. Whether you're a doctor, scientist, nurse, physical therapist, or a stay-home individual, it is incredibly important that we have a role to play. But what is that role? What is this sense of whole of society approach that we also saw from Professor Takian's approach in Iran? But I think the Professor Takian's approach also reminded us that context matters. It does matter. What is your society like? What is your political framework? And I think it is incredibly important for us not to forget that the discussion of COVID-19 is also a political discussion. And sometimes, obviously, as scientists and public health professionals, we hesitate to jump into that. But I'm looking forward to the discussion of Professor Takian, as you moderated, hope that we can delve a little bit into this relationship between politics and health. So with those summarizing comments, I'll hand it back to my colleague, Professor Takian, to moderate, and I'll come back at the end to provide some additional reflections. Thank you.
Thank you very much, Professor Haider, for your insightful remarks and a good conclusion and the interesting points that you raised. With your permission, we go to some questions directly, and based on the question, I will direct to our distinguished panelists, and I will ask them to respond to them. And if one of you colleagues have further explanation about some of these points, please feel free to join after I raise the question to a specific panelist. One question comes from Indonesia, and the gentleman or lady called Ramani asking about he or she wants to know what is the indicator that the national authorities determining whether the wave is still the first, second, or the third of pandemic. What are the best interventions to prevent future waves of this to happen? And I would like to ask you, Dr. Chan, to reflect upon this question, how we can actually identify the waves and then we can prevent them. Please.
Thank you, Professor. Let me share this, at least what Hong Kong does. When I said Hong Kong has gone through 3 waves, on each and every occasion, we go back down to 0, okay? And then when it comes back up again, that we count it as a second wave. And when the second wave goes back to 0, we count it as the third wave. So each and every time you go back to your baseline, okay? So that's how we do it. Now, I like to be frank and jump on a few questions that were raised by my dear friend Adlan. This, to me, is deja vu. The World Health Organization very clearly, after the H1N1 pandemic of influenza in 2009, sound the alarm clock very loudly that the world is not prepared for a severe influenza pandemic or any major sustained communicable diseases of similar magnitude. Unfortunately, the world did not wake up to that call. Another point is also deja vu to me. I still remember one big country was very unhappy and upset because at that time, also 2009, all the medicines effective for treating influenza were bought up by the rich countries and leaving the not so rich countries high and dry. So what are we doing? The world has not learned lessons yet. And the last point I want to jump in to say that health and economy are not mutually exclusive. The experience we have in Hong Kong, in Taiwan, in Singapore, in other parts of the world is that you need to take a two-pronged approach. Basically, you need to be very vigilant on the one hand to make sure that there is a cluster emerging, you have the health system capacity to bounce back and contain that. But on the other hand, is to have an orderly revival of your economy, to make sure that when your outbreak is under control, people feel safe. People need to feel secure to go out, to shop, to do business, and to go to school. So these are activities that will bring the revival of economy. To be frank with you, this is exactly the two-pronged approach that has been taken by some countries in the Southeast Asia region and including China. And that is my observation as well. So perhaps I'll leave it at that and I'll come back.
Thank you very much, Margaret, for this very important intervention that you made. I will come back to you again with the experience of China, and I have a specific question from the audience for you, which I will raise in a minute. Martin, I would like to ask the next question from you. A gentleman called Hans Christian Ritz has asked whether, because you mentioned about the equitable access to the medical equipment, specifically vaccine, in Johnson & Johnson and the private industry, you are helping for the development of this product, which is very important. So you put huge money and resources to develop those things. But the question is, to what extent and how you will ensure that equitable distribution of those equipments around the world, specifically for the poor and vulnerable. I remember our very good mentor, Detlef Ganter, the president of World Health Summit, was telling us that he joined from molecular biology, molecular medicine to global health, because he realized that whatever advances happen at in the laboratory and production. What matters is how we can actually ensure equitable access to those things for the poor and vulnerable. So what is your reflection on that?
Before I answer that, Amir, can I just speak quickly to Dr. Chan, to your comments? We also had a second deja vu with Ebola, if you recall, under your tenure, where in 2014 we had the large West African outbreak. The world, I think, reacted rapidly with enormous collaboration. Within, I think, 12 months, we had global trials, and we now have 2 very effective vaccines with the potential, if deployed broadly, to maybe eradicate Ebola epidemics, okay? One of the issues, I think, is we don't tend to invest when we're not in an emergency. And there tends to be a false sense of security when things calm down, people relax, the focus is gone. And although I think coming out of the Ebola emergency, we have 2 vaccines, which I think is going to be an extraordinarily positive legacy for that disease. That disease, of course, is more containable in the way that it's 80% to 90% mortality and much more manifest clinically. However, the same lessons could have been learned, where we had SARS-CoV-1, then we have Ebola, and if we had maintained, I would imagine, an international momentum and higher levels of international, I think, investment in global health security, we may have been in a better position to tackle where we are now. But it's just another point. Now, to answer the question, Amir, and to the viewer, so we made a decision that we will do everything we can to ensure equitable access of the vaccine. Countries pre-ordering the vaccine, it's their sovereign responsibility, according to their policies and their governmental policies, to distribute their vaccine nationally. But I think we recognize globally as an industry that we also have a responsibility to ensure availability of vaccine for underserved communities and low and middle income countries that wouldn't otherwise get it. And for this is exactly why we issued the communique. It's a form of holding statement to say we are committing as an industry, the Gates Roundtable CEOs of all the major pharma, R&D-based pharma companies around the world, we are committing as an industry to make vaccine products and therapeutics, diagnostics available to low and middle income countries. Now, we've committed 500 million by the middle of next year, up to 500 million to be available. I believe other companies will do the same. And how we do that is currently being negotiated through, I think, very effective global normative bodies like Gavi and the Gavi COVAX group. So that is being done right now and is being taken very seriously and is being translated into action.
Thank you very much, Martin. I have a very important question for you, Joe. I think very relevant to have developed. The question comes from a good friend of ours, Professor Selma Karabi from the University of Istanbul. She's asking the question about the transparency and the governance of the health system and the total governance of the country. And she wants to know, to what extent, in your views, transparency and being transparent about the COVID situation in the country is affecting the compliance of people for restrictions, precautions, and things. So to what extent in your framework you are addressing this issue of transparency, and because you are somehow addressing the healthy and healthier future after the aftermath of this COVID-19, what is your advice to the governments for this very important dimension of the good governance? The floor is yours.
Thank you. Yes, a very important question. Ultimately, how transparent a government is affects how much their population trusts their decisions and also is compliant ultimately to their decision making. And you can see that's being played out in a number of high-income countries as well as other settings, for example, in Africa. I think, though, I mean, ultimately, the more transparent and the clearer the communication and the rationale and focusing on key principles, rather than being extremely heavy on legislation, helps to engage the wider population, as well as cross-party decision-making. And I mean, you can see in the UK a situation where not all decisions have been made in a transparent way, including from the evidence the scientific evidence to inform some of the decision making has not been made widely publicly available, and actually it's causing splits in terms of the political party itself, in terms of how the decisions are being made. And there's debate even today about sort of taking a different stance on COVID. So that's a very sort of direct illustration, I think, of how transparency really matters. I think one of the other reflections I'd like to say is that some of the more successful countries where they have communicated more transparently tend to have had female political leaders who have had a different style, have put people very much first in the pandemic, that their lives matter. They've called for an early response. They've engaged their population and their political leaders as well. So it's part of a style of government and a style of leadership. I think ultimately going forward, this pandemic, as well as the planetary emergency, we need to evaluate and actually think about what sort of leadership style we need, not just politically, but also in public health, to try and prevent and avoid and intervene early in these sort of situations. Thank you.
Thank you very much. Before I come to you, Professor Chang, I have this particular point from Margaret again. If very briefly, Margaret, can give us your reflection about the last point that Joe mentioned about the women's leadership. What is your quick intake and reflection on that?
I am biased. I'm a woman. I have always supported women and, of course, gender equity, which is so important. I think, you know, the success story in Hong Kong, I don't know about other cities and other places. We have from the top to the Minister of Health to the Director of Health, they were all women. But that is not to say they do not get criticism. Of course they do. And that comes to the difficult point about making decision. Decision making is so complex and the context matters. For example, as Dr. Chen from Taiwan has mentioned, our previous experience with SARS matters. And also the political system matters, and whether or not your values also matters. So to make decision making simple is not. Actually, it is quite complex. You need to think of all your stakeholders, and all you can do is to focus on people. And people are smart. They know it. If the majority of the people are happy, some, well, I'm sorry to say, you can't please everybody. That is the job of a leader in a country. Otherwise, how can you maintain the social contract with the people in the country or in the city? Over.
Thank you very much. The reason I asked the second question before I go to Professor Chang was, again, exactly for this reason of gender equity, because we have more males than females in this panel. So I want to make the balance. So that's the reason for making it more equitable. Sorry about that. Professor Chang, the next question is for you. And I guess this is very relevant to your experiences. Somebody is asking Mr. or Mrs. Gomendo, to what extent, Mr. or Mrs. Krakow, to what extent the size of country matters? So if the country has 2 million population, or like my country, over 80 million population, if the country has a very centralized health system or a kind of federal health system like Germany, like the United States, so how it works and what is your insight about the size of the country for control and mitigation the risk of COVID-19? Over to you.
Yeah, in general, size matters. In this time that you can see is island nations or city-state, they are doing better because of all these measures are easily implemented.
I cannot hear him.
They have to take more negotiation to have some implementations. So in general, it works. But if you look at China, it's a big country, and they started, but later on, they also solve it very forcefully. So, you know, it probably you need to take different approaches during different time to do that. So that's a very interesting phenomenon, very good question. And let's go back to the first questions. I really think we have to have a global solidarity of looking at all these things. If you look at the data from WHO, we are always in the same wave. But this part, that part, people will, you know, feel, well, the epidemic in my country succeed, but globally it's still going on. So in Taiwan, we always say this is ongoing pandemic. We're still in the first wave. If you're looking around our surrounding countries. So I would advocate this needs a global effort to solve. No one country, no one company can do this. And we have to support WHO global efforts and have global cooperation to face the even more challenging winters wave of this. So I think that country size matters, government system and political system matters, but as Margaret just said, and this is transparent and continuous communication to gain the trust between government and citizens and motivate citizens to do some things, not let them be passively staying home. I think that's we have to come up with some good solutions in the coming months. That's my suggestion. Yeah.
Thank you very much, Professor. And
can't hear you so well, Amir.
Dear Adnan, before we go to the second round of interventions, I would then summarize the first. Okay, can you hear me?
Much better.
Yes.
Yeah.
Okay.
Yeah, now much better.
Okay, sorry about that.
And you've gone again. We lost you again, Amir.
Yeah, I mean, we've lost you there.
The internet is sometimes unstable. Adnan, before we go to the second and the final round, we have 18 minutes left. Okay, can you hear me now?
Yes.
Yeah.
Can you hear me? Okay,
yes.
I hope. Okay, Adnan, I want you to answer these questions, whether instead of PCR, we can use some kind of more and cheaper and antigen testing or antibody testing for the mass population, and then give us the reflection of the first round before we move to the second round, please.
So thank you very much, Amir. And I saw that question on the chat board. I really think it depends upon the rate of false negativity and false positivity that we are dealing with. I think the antigen tests, in your question, you wrote that if it's positive, then you move to a PCR test for further positivity. The question, of course, is the false negative. And when you have very, very high false negative rates, even though antigen tests are improving, it is of great concern. Some of the experiences from the US, when mass gatherings, particularly political mass gatherings, have happened, even though antigen test was used, actually they became super spreader events. And fundamentally that may be linked to this notion of false negatives. So I think we will have to be much more specific in terms of which test we are talking about in order to delve further, but I hope that that gives you a pathway. Amir, I thought that this first round was incredibly important. In the next few minutes, what I'd like to consider is a slightly more challenging sort of question and answers as well. We've talked about the lovely collaboration that has happened. Martin talked about the wonderful collaboration as well. Well, I think there are some holes in that collaboration. I think there are concerns about nationalism. I do think there are concerns about countries and scientists withholding information. I also think that this notion of vaccine distribution and this concern for equity, we want this in real terms. We've heard both governments and the private sector talk about it before, but not deliver on it. So it is important that transparency be a universal principle all around. How can we do better this time? How can we go beyond these declarations of transparency and collaboration to actual implementation on the ground? Let's challenge ourselves a little bit more in the second round. Back to you, Takian.
Okay, thank you very much, Adnan. I would like to go to each of the panelists, and this time I start from another way around. We start from Margaret, and this time we end with Margaret. I would like to give each of you 2 minutes. Please be very vigilant about the time. And the question that Adnan mentioned, so we have good frameworks. We have, at the meantime, we are living in a world that vaccine nationalism is becoming an issue. So the Secretary General of the United Nations, the Director General of WHO, and everybody is talking about the danger of this kind of nationalism and going within rather than going outside and beyond, which is bringing the challenges to the COVID-19. Unless we can have this meaningful collaboration, this is not going to happen. I would like to start from with Professor Chang. And I have you 2 minutes of intervention, Professor Chang, to tell us how you can see in the future we can get out of this lack of collaboration. You, Martin, before we move further, please. Martin, the floor is yours.
Oh, me? Sorry, I thought you were going to Dr. Chan. Okay. Well, I mean, I can only say from the position where I'm sitting, which is very much on the medical scientific side, I would call it the R&D access layer. It's probably a little below the political layer, operating, as I said, in a global company. I think industry is taking quite a positive lead. I think there was an acknowledgement, and this didn't happen actually with, I think, to the extent that I think we're seeing now with prior epidemics and potential pandemics. But I think what we're seeing is a very, very significant commitment in the recent communique to making COVID vaccines and therapeutics available broadly and equitably, including low and middle income countries. And I think we're seeing companies making that commitment. We've made a commitment, public commitment, that we will make up to 500 million doses available starting middle of next year, which is going to be a parallel and I think a rollout of a vaccine, if approved as safe and effective, to be rolled out at scale to high, middle, and low-income countries. So I think every single player has a role to play, and sometimes it takes for the actions, I think, of certain parts of our ecosystem, whether it be a company, a consortium, whether it be a normative body, or whether it be an NGO, to actually kick that off, you know, as a catalyst. And I think we're seeing that catalytic effect happen. So I remain quite hopeful. We have a great system actually with Gavi, COVAX, and CEPI, and we have support politically, I think, WHO as well. And I think that's the place to start. We have to start somewhere. You can't necessarily get everybody together and aligned and then have an aligned position to start. Sometimes individual players have to kick this off. And I think we're seeing that, and I think it's going to happen. I think it's real.
Thank you very much for your optimism. Professor Chang, what is your intake of the challenges of cooperation in the future to combat COVID-19? 2 minutes, please. Professor Chang from Taiwan. Professor Chang from Taiwan, please. Yes.
Yeah, we need a new format of this cooperation. And I think COVAX is a very good beginning. That from this viral I read, equity is stressed there, and they set up some kind of a percentage of population can be covered for each individual countries. And I think this kind of format has not been done before. And so I would really like to see the leadership of this COVAX in the futures. They can really pour all.
I've lost sound. I can't hear Dr. Chan.
Dr. Chan, we lost you, I think. Dr. Chang? Okay, I think we lost him. Can I ask
to get the machines in the future?
Oh, okay. Okay, you're back again. Okay, Dr. Chang, thank you very much, because we are not hearing you. So with your permission, I go to the next panelist. Joe, please share with us your insight about this.
Thank you very much. I've actually pre-recorded the recommendations from the Interaction Council, which I'm hoping the IT team will put up as a short video, partly to avoid cutting out in the same sort of way. Is the IT, there we go. Thank you very much.
Yeah, it's happening. Yeah, thanks.
Okay, thank you. The Interaction Council COVID policy framework also outlines a number of initial recommendations going forward. These cluster into two main areas, firstly around strengthening public health systems, and secondly around strengthening governance and multi-sector responses. Regarding strengthening public health systems, we can build upon existing approaches and tools, for example, by the World Health Organization and the World Federation of Public Health Associations. And this slide illustrates how something like the Commonwealth Health Protection Policy Toolkit can be integrated into a health systems strengthening framework. Ultimately, though, going forward, we need to invest substantially into our public health systems and emergency preparedness systems at national, regional and global levels. In terms of governance and multi-sector responses, there's a clear recommendation about strengthening leadership, both from a public health perspective, but also for our political leaders in terms of having the capacity and ability to address emergencies and pandemics. There's a further recommendation about establishing independent global emergency mechanisms, and this needs further deliberation and also clear links in terms of strengthening with WHO capacity. This in turn could be developed with a multi-sector emergency response mechanism for our planetary emergency, ensuring that we strengthen our links with planet and people in early detection, alert, prevention and preparedness systems underpinned by research for prevention and preparedness. As part of the follow-up from this report, and in partnership with the Commonwealth Digital Health Centre, I'm delighted today to launch the initial digital platform for planet, place and people. This aims to provide a range of open access digital tools to deliver health systems with strong links to the planetary health agenda. And I'd particularly like to thank my team of digital health fellows from Sri Lanka who have worked exceedingly hard to get this in place ready for today. Thank you.
Thank you very much. It was a very insightful recommendation. Before I turn to Margaret, just a couple of points from my own perspective from Iran. Then I ask Margaret, and then I ask my distinguished co-chair to end the panel. I guess this challenging time needs a number of things, specifically in the context of middle-income countries and low-income countries where I come from. The first thing is evidence-based policy making, which is very important in terms of how we can actually use data to drive our decisions and to actually allocate the resources based on the priority. We are hearing a lot that the pandemics will be with us, even the COVID-19 is over. We are going to face other things, and this is the time, based upon these experiences, to do this. And I guess I call upon a kind of global governance and the leadership of the World Health Organization and the regional organizations as well, in order to provide the governance for sharing the policy lessons and embedding policy, evidence-based policy making within the ministries of health. The second thing is, Margaret, when you started universal health coverage as a global initiative, we never knew that the time that comes that universal health coverage becomes a necessity, even for controlling the pandemics. I mean, the whole things from the World Health Organization, the notion of universal health coverage, the notion of good governance, the battle against non-communicable diseases are very crucial and important. And we don't need to remember ourselves that how important they are, and we need to do efforts in order to make it happen. And finally, climate change and the way that climate change is affecting us in good ways. I'm very happy that interaction framework that Joe just launched is addressing the issue of planetary health in good ways. And I don't see any reason that this should be forgotten. And I hope global governance will be better in the rainy days after this in order to overcome the challenges and build the better world upon this. Margaret, I'm gonna give you 2 minutes before we have 3 minutes for our co-chair for conclusion, please.
I will need just 1 minute. Being the last person to speak, all I need to say is that, and actually I've been listening very carefully, I agree with all the comments and the recommendations from the previous speakers. Now, there's only one thing we need to do. We need to track countries and to track industries, NGOs alike, whether or not they are keeping their promises. Promises to make this a better world in solidarity and in equity. Because having worked in WHO all these years, I noticed one thing across the board: overpromise and underperform. And that is one thing we need to change, especially in the post-COVID era. Over to you.
Thank you very much. Indeed, very, very important. We need to walk the talk and we need to act in more meaningful ways. With that, I would like to thank you very much, all the panelists, all the people who participated and listened to us, and the fantastic questions. And then I want to leave the floor to my distinguished co-chair and friend, Professor Adnan Haider, for concluding remarks and closing the session. Adnan, over to you.
Thank you very much, Professor Takyan. And of course, my congratulations to our amazing panel for raising so many critical issues when we consider national responses to COVID-19. Maybe I can provide just a few closing reflections. The first, I think, is that what you're hearing from us, dear participants and those who are listening to us live, is an emphasis on science. Science must lead the response to COVID-19. I will make a statement here that science is also under threat in many countries, and data is being challenged. So it is incredibly important for those of us who are from public health, from medicine, from healthcare, who believe in data, to make sure that that science-based approach is dominant. Second, I think the notion of solidarity is incredibly important. I think all of us have been providing perspectives on types of collaboration and engagement around the world, but solidarity goes beyond. It is about feeling for others around the world as well. It is about caring for others who are part of our humanity and part of the global citizenry, which is incredibly important. Third, systems matter. So the health system matter, the political system matter, the economic system matter, and the balance that Dr. Chan talked about, where both of them, the health, the economy, has to survive together, is incredibly important. So having a systems approach to COVID-19 is incredibly important as well. And fourth, which is, I think, relevant to many of us, is that we are talking about society. We are not talking about those people who get COVID. We are not talking about those individuals who put themselves at risk. We are actually talking about a disease that affects all of us. We may be asymptomatic carriers. We may have friends and loved ones who are vulnerable populations. We may have others who actually succumb to the disease. This disease is affecting presidents and prime ministers. It is also affecting those who are the most vulnerable parts of our society. And that's why this notion of a whole of society approach is also important. So if you've learned anything from this panel today, I beseech you to think about those 4 S's: the S of science, the S of solidarity, the S of a systems approach, and the S of society. And if you keep those 4 S's in mind, I hope that it will allow all of us to work together and really strengthen all of our country responses to COVID-19. I think this session has been incredible. The wisdom that Drs. Chen, Fitchit, Nurse, Chang, and Takyan bring is incredibly powerful. I hope, obviously, that this is just 4 or 5 of the numerous countries and member states of the World Health Organization that you've heard about. But I think it is important today to learn from these lessons and think about our imminent future. Ladies and gentlemen, over 40 million people have COVID-19, over 1 million people have died from this disease. This is an incredibly important moment in public health, in global health today. I thank the World Health Summit for organizing this session, and to all the panelists, and also my distinguished co-chair, Professor Takyan, for joining us today. Thank you for your comments, and let's keep the conversation going on social media and in other places. Thank you very much. Take care.
Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you.
Thank you.
Thank you.